Okay, so you want to start testosterone replacement therapy. Maybe you are in your late 30s, your 40s, or your 50s, and you have been feeling tired for a long time now. Waking up in the morning feels hard. Working out leaves you feeling wiped out for days instead of energized. You struggle to focus at work. Your sex drive has dropped. Your mood feels low, heavy, and hard to lift. Then a doctor on a popular health podcast brings up an interesting idea. Maybe you aren't just getting older, maybe your body is just dealing with low testosterone. And he make it sound so easy. Just apply a gel or take a quick weekly shot, and you'll feel like the younger version of yourself again. When you hear that, it feels like an easy win. Your body fat drops, your focus comes back, and you feel driven again. It sounds just like refilling a car that was running on empty. There is real science behind why that promise sounds so good. Testosterone is a natural hormone in your body that helps build muscle, strengthen bones, keep your brain sharp, and make red blood cells. It is also true that as men get older, their natural testosterone levels slowly drop by about 1% every year starting in their 30s. So the idea isn't a fake story. The hormone is real, the natural drop is real, and for men who have a real medical deficiency, replacing it can truly help. It sounds like a great deal, doesn't it? Now let's step inside the body and see how your biology actually responds. To understand what happens when you take extra testosterone, you first have to understand how your body makes its own testosterone. Your body does not treat testosterone like water in a tank that you simply refill when it gets low. It treats it like a continuous conversation between your brain and your body. This conversation is called a feedback loop. This loop starts in your brain, in a small area called the hypothalamus. This area acts like a biological thermostat. Every few hours, it sends out a chemical message to a tiny organ at the base of your brain called the pituitary gland. When the pituitary gland receives this message, it releases two messenger signals into your blood: luteinizing hormone and follicle-stimulating hormone. These two signals travel down through your bloodstream until they reach the testes. When luteinizing hormone arrives, it tells special cells inside the testes to make testosterone out of cholesterol. At the same time, follicle-stimulating hormone tells nearby cells to make fresh sperm. This whole chain, the brain, the pituitary gland, and the testes, is called the Hypothalamic-Pituitary-Gonadal axis, or HPG axis for short. Think of it like an air conditioner connected to a thermostat. When your testes make testosterone, that hormone floats through your blood back up to your brain. When the brain senses that there is enough testosterone in the blood, it turns off the signal. When testosterone levels drop later, the brain turns the signal back on. Your body has been running this automatic system every single minute since puberty. Once testosterone is in your blood, it travels to your muscles, bones, brain, and fat tissue. Inside those cells, it turns on signals that repair muscle and rebuild tissues. However, your body also changes some of that testosterone into other chemicals. An enzyme called aromatase turns a small part of it into estrogen, the main female hormone. Men actually need a small, healthy amount of estrogen to keep their bones strong, protect their brain, and keep their mood balanced. Another enzyme turns part of it into a stronger form called dihydrotestosterone, which affects hair growth and the prostate. So, taking testosterone from the outside is not like pouring water into a glass. It is like taking manual control of a thermostat that was running on auto. You are overriding your body's natural control system. When a man who truly lacks testosterone, meaning his blood tests show very low numbers on 2 different mornings along with clear symptoms, starts replacement therapy, those initial short-term results often look like a total success. Within 2 or 3 days of a shot or a gel, blood testosterone levels jump out of the low zone and move into a normal, healthy range. Inside the brain, this sudden rise changes how you feel. Within 3 to 6 weeks, men report a clear increase in sex drive, better energy, and an improvement in morning erections. For men who were extremely exhausted or depressed due to low hormone levels, feeling better can happen within the first month. In the muscles, extra testosterone helps cells hold onto protein and rebuild faster after exercise. Over 6 to 12 months, clinical studies show men on therapy gain 3 to 6 pounds of lean muscle and lose 2 to 5 pounds of body fat, even without changing their routine. Bones also slowly become denser and stronger over the next few years. At the same time, testosterone tells your bone marrow to make more red blood cells. Red blood cells carry oxygen through your body. For men who were feeling tired because they had low red blood cell counts, this change gives them more stamina and energy. A massive study published in 2023 called the Traverse Trial looked at over 5,000 men taking testosterone. This study cleared up a major medical debate by showing that when testosterone is used carefully to restore normal levels, it does not cause a higher rate of heart attacks or strokes compared to a fake pill. For many men, this sounds like great news. But the same study also found secondary changes happening deep inside the body. Changes that show why changing a natural hormone system always comes with a cost. While the large study showed no increase in heart attacks, it did find 3 clear side effects in men taking testosterone: more irregular heartbeats, more blood clots in the veins, and a higher number of bone fractures. Why would a treatment that makes bones denser cause more fractures? Why would something that fixes low red blood cells cause blood clots? The answer goes back to the brain's thermostat. Your body is built to save energy. When you take testosterone from an outside source, like an injection or gel, your brain senses that there is already plenty of testosterone floating around. The brain decides it doesn't need to make any more. So the brain shuts down its natural signaling chemicals. Within weeks, those brain signals, luteinizing hormone and follicle-stimulating hormone, drop to near zero. Without those signals, your body's natural factory shuts down completely. The cells in the testes stop making their own testosterone, dropping natural production inside the testes by over 90%. Nearby cells stop making sperm completely within 3 to 6 months. Because the testes are no longer working, they physically shrink by 30 to 50% over the first year. While fertility can sometimes come back after stopping the medication, it is not fast or guaranteed. It often takes 6 months to 2 years for the body to restart its factory, and some men never regain their original levels. The second hidden effect happens inside your blood vessels. Testosterone tells your body to make red blood cells. But when you take extra testosterone, your bone marrow doesn't know when to stop. It keeps making more and more red blood cells. Doctors measure this using a number called Hematocrit, which simply means how much of your blood is made of red blood cells. A normal level for a man is between 41 and 50%. When that number climbs past 52 or 54% on testosterone therapy, your blood changes physically. Instead of flowing smoothly like water, it becomes thick, moving more like syrup. Thick blood is harder for the heart to pump. It raises your blood pressure and makes it easier for blood clots to form in your veins, which can travel to your lungs or brain. Finally, there is the estrogen problem. Extra testosterone gives your body more raw material to turn into estrogen. If estrogen gets too high, it causes fluid buildup, mood swings, and swelling in male breast tissue. But if a person takes extra drugs to crush that estrogen to zero, they end up with painful joints, weak bones, bad cholesterol, and severe sexual problems. If testosterone replacement has these real costs, why do so many men end up stuck on it, often taking higher doses than they need? The trap happens because of generic symptoms, online marketing, and a biological cycle that makes quitting feel terrible. A real testosterone deficiency is a specific medical condition where the testes or brain have failed. But in recent years, many private clinics and online subscription services have turned testosterone into a commercial product. They advertise to men using very common complaints: feeling tired, gaining weight around the stomach, losing focus, or feeling stressed. The catch is that those symptoms can be caused by many ordinary things, like poor sleep, high stress, drinking alcohol, or a bad diet. All of those things naturally lower your testosterone temporarily. If a man with a normal level of 450 nanograms per deciliter feels tired simply because he sleeps 5 hours a night, an online clinic might still sell him testosterone. When he starts taking it, he feels an immediate rush. High doses of testosterone act like a stimulant on the brain. He feels more energetic and stronger at the gym. He thinks his medication fixed his deficiency, even though he was never truly deficient in the first place. And just like that, he gets caught into the trap. Because the extra testosterone turned off his brain's natural signals, his own biological factory has shut down. If he tries to stop taking the medication, his body experiences a massive crash. The outside testosterone leaves his body in a couple of weeks. But his brain and testes are still asleep. It takes months for his brain to start sending natural signals again. During this time, his natural testosterone drops near zero. He feels extremely tired, anxious, weak, and depressed with zero sex drive. He assumes this crash is proof that his body needs the drug to function. So he quickly starts taking it again. He is now caught in a loop. Taking testosterone shuts down his natural body. Shutting down his natural body makes stopping feel awful. And staying on it requires constant medical management for thick blood, shrinking testes, and lost fertility. To see how these steps happen in real life, we can look at a medical case reported by hospital doctors in Britain. The patient was a 28-year-old male athlete who was brought to the emergency room with sudden, severe neurological symptoms. One side of his face was drooping, his right arm was weak, and he could not speak clearly. Scans showed he was having an acute ischemic stroke, a condition where a blood clot blocks blood flow to the brain. Strokes in healthy 28-year-olds are extremely rare. He didn't smoke, he had no heart disease, and he was fit. But a blood test revealed a crucial detail. He had been injecting high doses of testosterone for over 2 years without a doctor checking his blood. His blood tests showed his total testosterone was extremely high, over 1,500 nanograms per deciliter. His brain signals were completely turned off. But the most dangerous number was his hematocrit. It was measured at 62%. Over 3/5 of his blood was made of thick, jammed red blood cells. When you look closely at how his body reacted, the whole picture becomes very clear. First, taking high doses of testosterone kept telling his bone marrow to make red blood cells without stopping. His hematocrit climbed from a normal 45% all the way to 62%. His blood became thick like syrup, moving slowly through his veins and putting physical pressure on his blood vessel walls. Second, further genetic tests showed he carried a mild, silent gene trait called factor V Leiden, which makes blood clot a little easier than normal. In everyday life, that mild trait had never caused him a single problem. But combined with thick, slow-moving blood from high-dose testosterone, it created a dangerous setup. A clot formed in an artery in his neck and traveled straight to his brain, causing the stroke. The emergency doctors saved his life by removing several units of blood over a few days to thin his blood back down. They stopped his testosterone injections immediately. While he survived and slowly learned to walk and speak again through months of therapy, his recovery was long and painful. Because his brain's natural loop had been shut down for years, his body produced almost no natural testosterone for 8 months. He suffered from severe depression, lost muscle mass, and felt constant fatigue while his doctors worked to restart his natural system. This was not a mystery poison. It was a well-known biological response playing out when a powerful hormone is taken without monitoring or safety limits. Testosterone replacement therapy is not an evil drug, nor is it a miracle cure. It is a precise medical tool. Used correctly, it changes lives for the better. Used incorrectly, it creates serious biological problems. Done right, therapy starts with proper testing. A doctor orders at least 2 separate blood tests taken early in the morning, before 9 a.m., when natural levels are highest, to confirm that testosterone is truly low, usually below 300 nanograms per deciliter. Before writing a prescription, the doctor checks for simple causes of low testosterone, like sleep apnea, heavy alcohol use, high stress, or poor diet, and tries to fix those first. If therapy is truly needed, the goal is simply to bring levels back to a normal range of around 400 to 700 nanograms per deciliter, not to turn someone into a superman. The doctor uses small, frequent doses to keep hormone levels stable without wild spikes. Monitoring happens every 3 to 6 months. Doctors keep the hematocrit level safely below 52%. If it gets too high, they lower the dose. Cholesterol and prostate markers are checked regularly. If the patient wants to have children, the doctor adds specific medications to keep the natural factory working. This careful method restores normal health while keeping risks low. Done wrong, therapy starts without proper testing, often based on a single afternoon blood test or general complaints like feeling tired. High doses are prescribed right away, pushing blood levels way past normal human limits, often above 1,200 nanograms per deciliter. Large, infrequent shots create big hormonal spikes, causing high estrogen conversion and driving up red blood cell production. Blood monitoring is completely ignored. Hematocrit climbs past safe limits unnoticed while the person relies entirely on feeling good as their guide. When side effects like high blood pressure or hair loss show up, More unmonitored pills are added to mask the symptoms instead of fixing the dose. The treatment continues until a health event, like dangerous blood pressure or a blood clot, forces a sudden stop. The drug itself is the exact same in both cases. The only difference is the dose, the testing, and whether anyone is paying attention to the biological thermostat inside. At the end of the day, testosterone is just a chemical signal, and your body simply reacts to how far you push that dial.